Good morning, everyone, and welcome to today's ISCRR Learning Series session. This is the last session for the year. This year has disappeared from us very quickly. My name is Jimmy Twin. I am the Research Communications Manager at ISCRR, which is the Institute for Safety, Compensation and Recovery Research. Firstly, I wish to acknowledge the people of the Kulin Nations on whose lands many of us are based today. I pay my respects to their elders, past and present, and we extend that respect to First Nations peoples here today. For those of you who are new to the ISCRR Learning Series, each month we present a topic on our research findings, the impact from our research, and best practice management of research. You can find out about future ISCRR events by joining our mailing list, and you can do so through the evaluation survey that will appear in your browser when you leave this session today. For our final ISCRR Learning Series topic, we're talking about ISCRR A Year in Review, presented by our Director Samantha Barker. Sam has been part of the ISCRR family for its entire history of 13 years, and throughout the life of the Institute has played an integral role in shaping ISCRR's strategic direction, research activities, and maximising the use of research into practice through innovative collaboration and co-design approaches. Sam has led and conducted a range of applied research projects for ISCRR's main funders, WorkSafe Victoria and the Transport Accident Commission, including the Institute's Horizon Scanning Program, which was the first of its kind in Australia to focus on compensation health. During the past 4 years as Director, Sam has been instrumental in shaping ISCRR into the successful institute it is today. Now, without any more delay, I'd like to hand over to Sam now, who will be talking about the last year of ISCRR. Thanks, Sam.
Thank you. All right, so good morning, everyone. Thank you again for coming along today. As Jimmy mentioned, this is our last webinar of the year, and it's been a big year. I no doubt that most of you feel the same and are really looking forward to some time out. Hopefully you get some time out over the upcoming holiday break. For us here at the ISCRR team, being part of the university closes down for about 10 days. So we get a forced break, which will be really nice to disconnect and have some downtime and spend some quality time with our friends and families. For me, that will probably be doing some clearing out as well, which I think many will also be doing. So today's session is a reflection on our work and achievements for 2022, and a lot has happened this year, and it's always nice to use the end of the year to stop and reflect. Before I go into that, I'm just wondering, Jimmy, can we do a quick poll just to get a sense of I guess the type of organisations that our attendees are from today, because this is quite a different topic webinar for us. Usually we're quite project specific, but this is across the board. So just to make sure I tailor it, if you can just share with us which industry you work in, and if you use or how you use research to inform your work. Also, if you have time in the chat after that, could you also just pop in if you have had the chance to do any reflection on your year? I have no doubt you've all worked extremely hard in whatever it is that you do, and have had many achievements, learnt a lot, challenges and so on. But often we don't have the time to do this reflection. So I'm interested, have you done it? Have you had no time to do it at all and it's wishful thinking? And have you learnt anything from it? That would be really interesting to see in the chat. So have we got results come through yet from that poll, Jimmy? What have we got? So most are from government and academia, a few from very small numbers from not-for-profit, private and other, and almost all of you are using research to inform what you do. So very interesting, thank you. All right, so as I mentioned, it's a reflection. So for those who don't know too much about us, I will just touch on Who ISCRR is, partnership, as you know, between WorkSafe Victoria and Monash University, and we've been going now since 2009, so 13 years in. We cover 4 different areas of work, including undertaking research. We broker and facilitate research with other leading academic groups across Monash and other universities, with end users like WorkSafe and other organisations. We have a strong focus on how we translate and transfer knowledge to those end users that we learn through research. And we're also starting to undertake some training as well. The areas in which we work are quite broad, in the area of prevention of workplace injury and illness, recovery from workplace injury and illness, and that includes things like return to work, clinical treatments and interventions, and compensation system design. And we've got a growing program around mental health as well, given its prevalence in the community more broadly. Type of research that we do, we really work at the cusp of research informing policy. So it's very applied in nature and quite action focused. So we have a range of different, we call them products, including evaluations, reviews of existing academic evidence. We also undertake scans of, we say, what's happening on the ground. You know, you have the academic literature, but we also look at what's happening in practice and what's emerging across the sector. And we also use other methodologies to tailor to the research need. So we really draw on those academic methods for rigour, whilst ensuring that our research is fit for purpose and will help address the complex problems that they're trying to solve. And we work on a bit of a spectrum as to how in-depth that work goes. We have our snapshot work, which might take 2 to 4 weeks. It might be used just to inform some thinking on a topic, and it really uses existing information, all the way through to much more comprehensive, in-depth programs of work, which can take 6 months up to 3 years or longer, depending on the type of problem they're trying to solve. We also have a strong focus on the translation and dissemination of our work, and the products that we have are forever changing. So our list next year will be different again, to ensure that we really adapt to what our end users need. These include things like insights. WorkSafe have this fantastic initiative of a research insights library, which is really collating not just an executive summary, but the really plain language 3, 4 or 5 key points that come out from each research project that's undertaken. WorkSafe have a really strong focus on using evidence to inform their thinking, and they have a really strong investment in research, including into ISCRR, but also in a range of other partnerships and other academic institutions, and all of that is brought together in their research insights library. We undertake a range of synthesis across broader topics. We undertake research, workshops and seminars, and other tailored products, including other visual activities to help bring those findings to life. We assess the impact of our research, and we will start to undertake more in-person events. We have one coming up early next year in February, which I'll touch on shortly. So there's 5 areas I'm going to touch on in the session as to what we've done over the past 12 months. The first is around ISCRR's new strategy, 5-year strategy. Some of you may know about the strategy, some of you may not. So I will touch on that. It's a really exciting milestone for the Institute. We've had another year of delivering a pretty significant research program to WorkSafe and some other partners as well, crossing across a range of areas. And this has extended to quite a lot of engagement with our stakeholders through, formal presentations, workshop meetings, training workshops and other areas. And it's been great to be able to start doing a bit more of that work face-to-face, as well as using online tools. When it comes to research communication, so how we disseminate that information is really one of the most important steps, which I know all of you will appreciate, and we're continually refining how we do that. And I'll touch a little bit on a couple of the initiatives that we've done this year. Feedback shows our partnership with WorkSafe is really at its strongest ever. We've got really high partner satisfaction, the use of the research into practice, and anecdotal feedback has been really positive. So it's nice. It's a nice note to finish the year on. And the last area I'll touch on is around ISCRR being a great place to work. Without having great people to undertake all of this important work, we couldn't exist. So it's a really, really strong focus for myself and the management team to keep improving and ensuring that our staff are happy and supported and empowered in what they do. So just firstly, looking at our strategy, ISCRR passed its 13-year anniversary this year, which is actually scary for me to think, and it's really a signal of its maturity and a really significant milestone for the partnership. Our founding partners especially being Monash and WorkSafe. And with impact from our research and that partner satisfaction I touched on at an all-time high, we felt that the time is really right now to take that next step and think longer term into the future. So what this means is our scope of work has expanded in our research areas. So rather than just focusing specifically on workers' compensation in the areas that fit within that scope in Victoria, we're looking nationally, and we're looking at broader areas, including things like organisational culture and fields within organisational psychology. And we're also opening up opportunities to work with other partners and other end users. So our vision is to improve the health and wellbeing of the Australian working population and their families. So there is a broader remit there as well. And we'll do this through using high quality evidence to inform, advise and educate. We've got 4 goals that we are focused on over the next 5 years. One is research excellence, and this is really about constantly reviewing and refining our methods to ensure that they're both drawing on a rigorous approach that is independent and can be replicated, but are also fit for purpose in which the research will be used. And one example of this is our evaluation program, which has really grown over the past few years. And we now have a really strong action-based model that constantly feeds back into implementation. So rather than us just conducting evaluations along the side of the intervention, we're really quite woven in to ensure that the findings are constantly being fed through in real time. And this has been quite a successful model that we've seen in a few projects over the last 12 months. Impact through the transfer of knowledge. But we've been assessing impact for a while now and focusing on the dissemination of knowledge. But the shift here is that we are really focusing on building the capability and capacity within our end users to be able to use the findings and the insights that we share in their work. It's a collaborative effort to make change, and we can help with delivering that evidence and recommendations in how it's used. But ultimately, all of you there that are employed within, whether it's not-for-profits, government, private sector, and so on, we want to help you take that information, but ultimately we want to help you have that capability and skill to be able to implement those findings, and that's where the impact can occur. So we'll have quite a strong focus around that over the coming years. Thought leadership ties in a bit with that knowledge transfer area, but we're looking here to distill evidence in different ways to really challenge the status quo and to think more broadly about systems-based change that is transformative as opposed to incremental. And just lastly, a focus on new partnerships and collaborations. And some of this ties into avoiding duplicated effort and really building connections between the work that we're doing and how it can be useful to others in the ecosystem in which we operate. So that's a really exciting part. And that also, within that, includes focusing on ISCRR as a great place to work, which again is important for our sustainability into the future. We've updated our research model, which I guess has evolved over the years as we've learnt about interacting with our end users and the important phases that we go through. And essentially our model is a continuous cycle from that co-design stage all the way through to assessing and measuring impact, but really talks about that notion of working with end users, people with lived experience and other relevant stakeholders to ensure that the work we're developing is policy relevant. It's going out and creating new knowledge through evidence, or also distilling that existing knowledge and evidence and making sure that's being used. It's then feeding that into new pilots and interventions and ensuring that those are evaluated effectively and efficiently, and transferring our learnings in a way that will really empower our end users to draw on those findings. And an important step at the end there is I'd say at ISCRR we have a bit of an obsession with continuous improvement and always looking for ways to be better at what we do. And this is, in this reflection phase is important for us to look at what worked well and where there's opportunities to improve. And it could be as specific as how some participants were recruited and how we could have achieved a higher sample in a particular study. It can be quite specific. Also to broader things around engagement and what was successful in dissemination of findings. So looking at the second area around the research program that we delivered, there's 14 projects delivered across the past 12 months, which is a fantastic effort by our research team. And this list here highlights the broad range of topics that we investigate there across discipline and across a range of different industries and sectors. And I'll touch on a couple of these now just to give you an example. So the first one is the Vicarious Trauma Prevention and Awareness Toolkit, which some of you will have heard of. And this is a pilot study that was funded by WorkSafe, but through a different channel, through their WorkWell Mental Health Improvement Fund. For those that are not familiar with what vicarious trauma is, it occurs when workers are exposed to other people's trauma, if I say it in a really brief way. It's cumulative in that it can occur without conscious awareness that it's happening, and it includes a range of psychosocial symptoms as a result of that. Examples of that trauma could be reading materials that relate to other people's trauma, watching videos or hearing accounts of other people's trauma. But as I said, it is incremental. So the person experiencing it may not actually notice their worldview change and their symptoms change as a result of that. So it can be very difficult to identify. Now, the aim of this work was to develop and pilot a toolkit to equip workers that are at risk of vicarious trauma, to give them the knowledge and information to help minimise that exposure. And this was a 3-year program. We partnered with the Commonwealth Public Service Union, the CPSU, to undertake this work, and they essentially managed the implementation of the toolkit, and our role was to inform that design and undertake the evaluation. Now, there were 2 government departments involved in this work, the Department of Families, Fairness and Housing and the Department of Justice and Community Safety. And 6 pilot sites from across those organisations were identified who had a strong likelihood to be exposed to this vicarious trauma, and a steering committee comprising of representatives from those organisations guided the project over the past 3.5 years, and ISCRR and CPSU oversaw the implementation. The key activities that were carried out throughout the pilot have been essentially to pilot different strategies that organisations can implement to prevent vicarious trauma. And this was also based on a model that was used over in the US in Boston, and then adapted to the context that we have here in Victoria. Some of those strategies include things like training and peer support sessions, but again, there were quite a few that were implemented during this time. And, one challenge for the project was that this was occurring during COVID. I think it was about 6 months before 2020 that this all kicked off, which certainly made things challenging, but the project team were fantastic in adapting and ensuring that the work could still continue. All of this work together fed into the development of the toolkit, which is basically a resource with information on vicarious trauma, but importantly, has really applied examples of how to prevent it. The key outputs are the toolkit, which I will share a link to in a moment. And we also have a whole lot of data now that can be used to really contribute to the understanding of vicarious trauma and what works and doesn't work in preventing it. The blue sky vision, I guess, of this whole pilot really is around prevention of vicarious trauma at the organisational level, really shifting that focus from that individual level prevention and resilience, which often occurs, and really looking at what the organisation can do to minimise that exposure. The pilot was underpinned by 3 key approaches, one being action research, which I touched on earlier, and this was applied to really optimise the learnings as the pilot progressed, and it allowed the team to adapt the approach based on feedback that was received from the pilot sites and the lived experience from the staff. And the actions and strategies that were piloted at each site were co-designed with frontline staff, management and the project team. So again, this really brought the lived experience to the forefront and was critical to the success of the project. The project wrapped up in September and was actually launched by the Minister and WorkSafe CEO, Colin Radford, which was exciting, an exciting achievement to see after all of the hard work that the project team had put in. A number of findings came out from this work and some gaps and opportunities that were identified. Firstly, it was very clear that the staff in the VPS in these areas reported frequent exposure to traumatic content. And interestingly, an audit of policies was done at the start of the project and really found no proactive prevention approaches that were targeting vicarious trauma existed in these departments. So there's certainly opportunities there which they're looking at. There's a strong reliance on quantitative data to understand and inform vicarious trauma risk, which is very difficult because, as you'll appreciate, vicarious trauma is not just one incident that can be identified and reported through an organisation's health and safety system. It is cumulative and nuanced, and really there's a need for a framework for assessing risk of vicarious trauma using more qualitative approaches. There's common misconceptions around not just what vicarious trauma is, but also discouraging around proactive prevention because of the awareness raising. And the pilot has really highlighted a mandate in a way and the resources to challenge this, but the impact that these will have will obviously take time, which is really important to be aware of. With the 6 sites that were involved in the program, as you would expect, the effectiveness was quite mixed. And there's some discussion underway and thinking around the impact that cultural maturity may have had on this, because it was clear some of the sites, when they came from, I guess, a culture that was more advanced in thinking about proactive prevention of not just vicarious trauma, but mental health conditions, psychosocial risks, and so on. They were far more successful in embracing and immersing themselves into this activity. And so that's an area that is being explored at the moment. And there's some specific strategies and supports that were really, really effective, but the effectiveness of these will be limited without that significant and pragmatic shift in the way that organisations view the risk of vicarious trauma. So as I mentioned, the toolkit has been published. It will eventually be on the Victorian Public Sector website. For now, it's being hosted on the CPSU website in the interim. There's the code there you can access. So it's essentially, I guess you could call it a draft of content. There's a fair bit of work to be done around its design, but certainly the content is there and it is open access for everyone. So the link there and also the QR code is there if you have time to access that. If you're interested, there's some really useful resources there that you can access for yourself and your teams. The second project I wanted to touch on is the clinical hotline pilot evaluation. So this is an intervention that WorkSafe Victoria trialled and we evaluated. And the aim of this pilot was to essentially test a phone hotline that workers' compensation insurance agents and the health practitioners or providers that treat injured workers could directly access this clinical panel for support. And the clinical panel have a range of clinicians on there that help with, I guess, a range of different activities to support the recovery of injured workers and ensuring that their treatments and, recommended journeys are evidence-based. And this was another opportunity to access that expertise. Participants really reported that, and I should say this was a qualitative piece, so there were interviews undertaken with the insurance agents, the health practitioners and the clinical panellists as well to gain their input on the success of the program. And they felt that the impacts that they had experienced would likely result in improved injured worker outcomes. And they also, many actually reported that their perceptions of WorkSafe improved given the role that it was extending to help and provide additional services and supports to those providers. All participants wanted the pilot to become business as usual, which was a really good findings. And there was some specific suggestions around how it could be tweaked and refined to provide further support. And this included things like potentially making it available to injured workers. Some of the challenges that they would have around workload as it becomes more and more popular, how can they increase that access for clinicians and agents to be able to access if it's scaled, and promoting the hotline. I mean, obviously the impact at the moment is small because it's a small number of callers. So certainly some work around its promotion was deemed to be important. And interestingly for this work, ISCRR adopted a guided approach to the evaluation and was involved in the hotline pilot from its inception. And that was including through the facilitation of program logic workshops to inform what the program would look like throughout its implementation as part of the working group for the pilot as well. And one of the other improvements that's been made since the evaluation is, as well as having a phone hotline, an email query option has also been implemented as a complementary approach to the hotline. So this was a really nice example of our evaluation approach, and again, that action approach and weaving through the involvement that we have. Just one last example, the program logic workshops that I mentioned earlier, we facilitated 8 of these over the last 12 months, and they help organisations really brainstorm and identify work through the specific problem that they're trying to solve and the actions that are required to reach those targeted outcomes. So it provides some structure to that thinking. And the process is really helpful for organisations because it creates a space for developing shared understanding about a particular area. And it also tests assumptions, which can often be there when you've got different areas of a business coming together to try and implement a new program or initiative. And when the workshop is completed, the participants have a document program logic that clearly explains the program strategy, where it's looking to go and how it will get there. And the participants often use this program logic to inform their evaluation framework, which we often provide assistance with as well. As I mentioned, there were 8 of these that were done throughout the year, which have 2 separate workshops attached. And our guru evaluator, Sarah Oxford, has really led this work and adapted the workshops based on the different topic areas that we have. The projects that we looked at range from really high-level explorations, such as how WorkSafe can improve their response to physical injuries in the workplace, which is obviously a really big picture topic, but also to really quite more niche projects, such as how the Victorian Produce Network can shape farming culture to be safer. So it can really be applied to any topic area. It's really the framework that is of most benefit. So then just looking through to communication, where, as I said, we're constantly refining how we communicate our research findings. And this year was the first full year of these webinars. There's 9 listed there, but with this one will be 10. And they're really here to educate and provoke thinking about different topics. And the feedback that we've had this year has been really positive, and thankfully, the attendance has also increased around 150% during the year. Do get in touch if you have a particular topic that you're interested in hearing about. I know the first couple of topics for next year relate to musculoskeletal injuries and mental health conditions, and there's another one around occupational violence. So stay tuned, but they will continue on a monthly basis next year. We've also been fine-tuning how we showcase our research impact successes. As you may know, we've been regularly assessing impact since around 2018, 2019, and our impact framework was recently highlighted by the Institute for Work and Health in Canada, in Toronto, as part of some case study work that they've been doing. And Dr. Jimmy Twin, who you met earlier, he's driving a lot of this work and sits on a couple of researching impact committees, both within Monash University and also nationally. And we're also providing some advisory support to other research centres based on the learnings that we've had to date. The research impact stories this year are a new part of telling the story about the impact that we've had. The research has had, and again, that's that continuous feedback loop as to how we can learn from that and feed that into new projects. We've also got some events to bring people together and share ideas and knowledge. The first one next year kicks off on the 9th of February, which will be a 3-hour event, hybrid event, both online and in person. We'll have opening addresses from WorkSafe CEO and the Deputy Vice-Chancellor of Enterprise and Engagement from Monash. And we'll have 4 program areas that will be touched on. That it'll be a little bit different to a traditional research session. So yes, we'll touch on the findings, but it's more about the story of how it's been used, hearing from the end users as well on the journey that they've gone on to achieve impact through that work. For those who haven't registered or are interested in attending, you can access the information through that QR code, which I'll show up again at the end. 2 more areas to look at. We're nearly wrapped up. So partner satisfaction. We've been assessing annually partner satisfaction from WorkSafe for quite a few years now, and we use the findings to help develop and refine how we work and what we deliver. And really over the past 3 years, satisfaction has remained consistent. I should note the sample here is between 20 to 25 people. So slight changes in numbers are not significant. So really we're tracking at that highest ever result, which is fantastic, especially considering that that's been mostly during the COVID pandemic as well. We're really lucky to have such a deep and productive partnership with WorkSafe, and also the WorkSafe research team play a key role in fostering that partnership, and I'd like to thank them for their commitment and friendship over the past 12 months. Lastly, ISCRR being a great place to work, we're really lucky to have some really talented and committed and fun people in the ISCRR team. This is actually more than who we have, but we've had 3 of our staff have additions to their family this year. So we've had 3 people off on maternity leave, which means we're lucky to meet 3 new people to join the team during that mat leave stage. And we've also got a couple of high degree research students as well, who we're lucky to have in our team. We do assess staff satisfaction. Whilst we're a small team, it's still important to ensure that our staff are happy and inspired and empowered to do the great work that we do. And it's really pleasing that they the high results that are reported about ISCRR being a great place to work, and especially that work-life balance, which is really important to us. Staff achievements, just a few listed here. With Janine, who leads our research area, was awarded Best Paper relating to spinal fusion surgeries at the recent ANSOM annual scientific meeting. Sarah, our evaluation guru, was nominated for a SACS Research Action Award, which is focused on translation efforts and impact that research has had. 3 of our staff have obtained adjunct appointments within the School of Public Health and Preventative Medicine. And as I mentioned just before, we've got a couple of research students. And I should say our honours student, Liv, who did some work on vicarious trauma burden, just recently found out she got a HD on her program. So well done, Liv, all well deserved. And well done to Janine and Sarah for your supervision there. And Edwina, our PhD student, is just embarking on some work around mood disorders and recovery from injury. And we're really lucky to have her as part of the team. Lastly, just looking at, we reflect, we look forward, and there's a lot happening already next year, and we haven't even started the year yet. One of the big areas is continue to implement that first year of our strategy. 3 areas within that is we're starting to work with WorkSafe to plan for our next 5-year program beyond 2024. Our current funding cycle finishes in the middle of 2024, and it's a good time to start thinking about what that next phase might look like. We're making some refinements to our governance, which includes introducing a new steering council, which is similar to a board, but it's not called a board, but we'll have quite senior representation on that to really focus on the vision and the long-term future of the Institute. And there's some new collaborations that are underway at the moment. ISCRR will be under new leadership next year. I'm actually finishing up, for those who don't know, in February after, I think it's 13 years. The time is definitely right. I'll be taking on a new challenge in my career, and it's a wonderful team that will be able to take the reins. And I look forward to seeing the new appointment that Monash will be organising over the coming time. It's a really exciting time for the Institute, and I feel blessed and lucky to have been part of the journey all this time. There's a Research Impact Showcase event that I mentioned earlier, and I'll be able to show the QR code up on that again. Please do register if you're interested, because there's some really interesting stories there to share. And importantly, our research program, we've got quite a few projects that we will be delivering next year around vicarious trauma, relating to occupational violence, and how buildings and accommodation are designed to ensure both safety of workers in out-of-home care, but also that supportive therapeutic environment for those who are in out-of-home care. And we're collaborating with some really great people on that work. We've got some more program evaluations on some really exciting programs that WorkSafe have been trialling, and again, helping WorkSafe as part of their strategic planning work, and some more clinical effectiveness reviews. So there's a lot on the agenda, but really excited to be having such a great program of work ahead. So that's it from me. Thank you so much to all of you for coming along today, and especially just want to say a thank you to all of our partners and collaborators and others that we've worked with this year. It's been a busy year, but a very productive one, and seeing the research that we do make an impact to the lives of workers, employers, and those who are injured is why we do what we do. And yeah, I wish you all a really enjoyable and safe holiday period and time to rejuvenate. I will bring that QR code up here for anyone else that's interested in registering. And Jimmy, I don't know, I know I've talked a lot. If we have time for questions, from there I'll hand over back to you.
Thanks, Sam. We'll have time for possibly 2 or 3 questions, and don't wish this to be your farewell speech or anything along those lines, but I think everyone who's listening today would share with me that very much that you'll be leaving ISCRR on a high, and thank you for your leadership over the past 3 years and all the work that you've done for ISCRR for the past 13 years, which has been an incredible journey. And part of my role is delving into all these success factors of the past, and it's a fascinating journey moving forward. That link for the showcase event is also in the chat as well, if you didn't manage to get your phone out to scan that QR code in time. Also a reminder that when you leave today's session, please make sure that you fill out the evaluation survey. That data is incredibly useful for us. And also it's an opportunity for you to leave your email address if you're not yet on our mailing list to receive our newsletter. And our final newsletter will go out next week, which will include the link for this session today. So we've got 2 questions that have come through. So for the first one, which leads on really nicely, Sam, in your opinion, what was the biggest achievement that ISCRR has had this year?
Biggest achievement, gosh, that's hard to pin one. I would actually say the strategy that's been approved, and the reason I say that is it's almost a new era for the partnership, and it's taken a lot of work to get it to this point, and it's quite a transformative strategy. That the actual document talks about it being transformative. In the fact that we've had these years of working very, very closely with Monash and WorkSafe, which we'll continue to do. They're our founding partners, but this is really the opportunity to leverage that investment and time and work and really lift it up and escalate a level. So it is quite a milestone for the partnership moving forward. Also, actually, one that just comes to mind, I was in a meeting yesterday with Colin Radford and Daron Ben-Meir, who's the Deputy Vice-Chancellor of Enterprise and Engagement, and Anita Zanchetta as well from Monash. And I asked Colin about how do you think the partnership is going? And something he said was, over the past few years, there's definitely been a shift in the alignment of the research that we do and WorkSafe's ability to use it. And they now feel that all of the research that they're getting is very much meeting their needs and solving the problems that they're trying to address. And that was really rewarding to hear that. I mean, the numbers that we get through the surveys tell us that, but to hear that from Colin, I think that's a huge achievement for the team, and that's been our strongest focus. Because if the research we do isn't used by WorkSafe and other end users, then there's not really much point in doing it. So a huge well done to the ISCRR team and all the people that we work with across WorkSafe and Monash and other areas for achieving that. And they would be my 2.
Great. And just to follow on from that, and this is very much us patting ourselves on our own backs here, but what do you see as the key ingredient to the success that ISCRR has seen? So like the secret sauce. I love that phrase.
Oh, that's a good one. I would say the first thing that comes to mind is the people. When we recruit and bring people on, we're not just focused on the technical skills, but the soft skills. Our team need to be very flexible and agile, need to be okay with adapting and changing priorities. So whilst it's not a full consulting environment, it's definitely a fast-moving environment. They need to have exceptional relationship management skills, ability to work in teams, and always looking to improve the way that we work. So it is a unique skill set that we look for, and it's the people that shape the institute that we do. The other has just been, I think, an openness to try and experiment ways of working. I think back to when ISCRR first started, when Alex Colley and Nikki Ellis were leading, and we essentially experimented so many different ways of bringing stakeholders together, trying different research. And it's okay to experiment and fail and experiment and see what works, and constantly look and seek feedback on how we can get better and better at what we're doing. And that's been really important to understand the likes of WorkSafe and what their real problems are, and seeing how we can complement. I mean, they have so much expertise within their organisation. We don't want to duplicate what they're doing, but how can we complement and help them with the work and the mission that they're trying to achieve? And they would be the two things.
And I think I'll add to that as well, there's very much been an emphasis working at ISCRR on work-life balance. And that's something where it really does feel like a ISCRR family in that regard, that there's always ever competing priorities and deadlines. But I think there's that acknowledgement that work is only one component of our lives, and you need to have that mental fit to be able to do your work adequately and productively.
Yeah. Actually, one other thing too is about focusing on the end point all the time. So, we might have some really interesting research projects that come up, but ultimately, if we don't have the right people around the table, if we're not clear on how the information is going to be used and what it's going to inform, we can do the research project, but its actual impact and benefit is not going to be a success. So I think another critical part has been starting with the end in mind with every single piece of work that we do.
So we've got time only for one more question. Thank you everyone who has stuck around to be listening to all these this discussion right now. And this is a nice one to wrap up the session for the year. Sam, where do you think that research in this area that ISCRR's involved in will be changed looking to the future?
Oh, that's a good one too. Gosh, these are good questions. Keeping me on my toes. Look, a couple of things come to mind. Many of you will have been in this sector and area for a long, long time. And I know I've worked at the TAC before I joined ISCRR, and I feel like a lot of the problems that are trying to be solved now were problems 15 years ago in the sector. Evidence has been used and experience has been used to start addressing those, but some of those fundamental problems are still there. And I think the next shift really is about looking at the systems in which the injuries and mental health conditions that are occurring. As we know, mental health claims are increasing significantly, and it's putting a lot of pressure on schemes, not just in Victoria, but across Australia. And it's a real challenge that's facing this sector into the future. So for me, research really needs to turn more to being what I would call strategic in solving that problem. So if we look at mental health, rather than solving little itty bitty problems within mental health, which are still very, very important, but we need to see about how that feeds up to this bigger community issue around mental health conditions and the rise in that across multiple generations in the workforce, and really come together as a research and academic sector itself to see how we can combine our knowledge and our minds to solve those problems. So it's really lifting up and avoiding that duplication of effort across the sector and beyond.
Thanks, Sam. That's all we have time for today. Thank you everyone for attending, and those who have attended our other 9 sessions that we have done thus far in this series. As Sam mentioned before, if you have any ideas on any future topics, please send us an email at info@iscrr.com.au. Complete the evaluation survey that'll appear in your browser when you leave, and looking forward to a very productive and prosperous 2023. Thank you, everyone.
Thanks, everyone, and wishing you a great Christmas and holiday break.